Okay, so we are going to get started, and I want to welcome you to the College of Public Health and Human Sciences Research Seminar. And I'm Marie Harvey, the Associate Dean for Research in the college, and I'm also delighted today to introduce Harry Heisted. Harry is an Associate Professor in the Environmental and Occupational Health program here in the college, and he has graciously agreed to introduce our speaker and to moderate the session. So, Perry, take it away.
Thanks, Marie. I get the fun job of introducing, but thank you guys for being here today. I know this is a busy time for everybody, for those online as well. If you're online, you're muted. So if you have questions, you're going to have to use the Q&A function. I'm seeing head nods. So please do that during the presentation, and then we'll get to those at the end. But it really is my pleasure to introduce Joan Casey today. She's a native of Corvallis, so she's very familiar with OSU. She recently moved back to the West Coast, unfortunately not here. But being at the University of Washington is a lot closer than Columbia. So we're looking forward to having more interactions at Cascadia and hopefully taking the train down here. So Joan's research, she's an environmental epidemiologist. She focuses on environmental health, environmental justice, and sustainability. Her research uses large secondary health data sets, such as electronic health records, to study the relationship between emerging environmental exposures and population health across the life course. She really is one of the researchers, I think, that's pushing environmental health forward, both in terms of what she's studying, but also the method she's using. So very glad you're here. Also follow her on Twitter. She has an amazing Twitter account. I'm very jealous. So I'll pass it over to you.
I think I can do it.
Address for her.
Yeah. All right. Wonderful. Well, thank you so much for the invitation to be here with you all. Like Perry said, I grew up in Corvallis, but I've never professionally visited Oregon State. So yeah, really fun to be here and look forward to chatting with you all and seeing more of one another now that I'm at University of Washington. So I'll get started. I'm going to talk a little bit today about some ongoing work I've been doing related to long-term exposure to wildfire particulate matter, which is becoming an increasingly important question as wildfire smoke is becoming more ubiquitous. Let's see if I can get this to advance. Great. Okay, so here's just a brief overview of what I want to cover today. Kind of what do we know about long-term exposure to wildfire and health? Brief spoiler is not that much, but I'll tell you what we do know. And then it's kind of this work that I've been taking part in around how should we go about measuring long-term exposure to wildfire smoke? And I'll talk to you a bit about why I think it might be different from ways we've previously conceptualized things like total fine PM measures. And then I'll talk about this study that we just completed, and there's now a preprint of looking at long-term exposure to wildfire PM in California and environmental justice considerations, and some interesting findings out of that I think kind of differ from what people have historically found, and then a tiny bit about kind of next steps in terms of epidemiology. So what do we know? Mostly that short-term exposure to wildfire PM on the order of days or a week appears to increase risk of emergency department visits and hospitalizations for cardiovascular disease and for respiratory disease endpoints. That's basically what we know at this point. But there are a lot of unanswered questions. So what about long-term effects? What does this look like down the line if you're being exposed a couple times a year to these big shocks of particulate matter exposure? What about other endpoints? So one I'm interested in is dementia. What about vulnerable subpopulations like older adults or pregnant people? And what is kind of, there's not, going to be a best measure of exposure, but what are some of the ways we should be thinking about exposure to wildfire PM? So one thing I'm interested in thinking about is dementia as an endpoint, and thinking about whether long-term exposure to wildfire PM increases risk of getting dementia in the first place. Does it increase how quickly you may progress once you have a dementia diagnosis? Is it related to mortality among people that have a dementia diagnosis? So those are kind of some of the bigger questions I'm thinking about as I'm trying to grapple with how to measure exposure. So what do we know about long-term exposure to wildfire and health? This is a review paper from a couple of years ago by Emily Grant, and they identified 17 studies that have tried to grapple with this question of long-term wildfire exposure and health. They defined long-term as health endpoints after 12 months after exposure. A lot of these have taken place in Indonesia, where there were these massive wildfires and pretty good longitudinal follow-up of folks. And this is an example, kind of a prototypical study looking at the long-term effects of wildfire. And so there's wildfire smoke exposure in 1997, and then this group is measuring endpoints in 2017. And they're not really looking at anything in the interim, and they're kind of using a yes, no was exposed in 1997 as the exposure. There's some other studies that are case-only studies looking at those that are exposed, and then looking at lung function down the road and kind of comparing to a chart of what we would have expected your lung function to be at that time based on your age and sex, and seeing that people that are exposed 12 months ago to wildfire smoke seem to have declines or lower levels of lung function than we would have expected. Similar type of study out of Montana. So most of these studies, can anyone read that? Seems pretty blurry. Okay, so I'll just tell you what they are. The red bar are studies of general health. Purple are respiratory outcomes. And then the vast majority of these studies have looked at long-term mental health consequences. I would say that's definitely where the best work has been done. And then the final bar is actually just modeling what we would expect the adverse effects of exposure to wildfire PM to be in the long run, based on kind of exposure response curves for total particulate matter that scientists have developed over time, but not actually going out and measuring in reality. So not many studies, no one's looked at dementia. Most of these studies are quite small. So a lot of the mental health studies that are really good, but are very community-based in one place, maybe following 50 to 100 people over time and looking at often endpoints like PTSD. But nothing comprehensive kind of population level, thinking about what does exposure to wildfire now mean in the coming years for people's health. So then, of course, when I was preparing to give this talk, another review paper came out. So let's talk about what they found briefly. So here they actually find 36 studies that again, they're defining long-term as 12 months after fires. And most of these, again, are focused on mental health, so 58%. And I think notably only 6 of these studies of the 36, so 1/6 with the new math, actually measured air pollution levels during wildfire events and then tried to link them to health. Most of these studies are out of Australia, Canada, and the US also. So these are the studies that actually looked at levels of air pollution and then tried to go on and look at health. And as far as we can tell, there's only been a single study that's looked at exposure and then health across the life course and included some measure of time-varying exposure. So didn't just look at all these other studies looked at what were the levels of exposure during the wildfire event, and then what happened to health down the road, kind of missing like interim years of exposure, just a total black box. And so this first study actually looked at fire source particulate matter in the year prior to child mortality and over the entire lifespan of kids and looking at child mortality as an endpoint. And so that's like so far the one study I think it's gotten sort of the closest, but still is missing some big pieces. And let me go on and talk about, okay, so no one's really tried to measure long-term exposure, but if we were going to, what might that look like? And so this is just kind of to get really specific, this is a single zip code in California from 2006 to 2020. And this is daily wildfire PM exposure. And so you can see on the y-axis, we're going from 0 to 300 micrograms per meter cubed. That is extremely poor air quality. The annual standard right now for the US EPA is 12 micrograms per meter cubed, so very far down here. But you can see this is very, very spiky, right? We're talking, the median is 0, the mean is 1, but the max is 310. So it's not the kind of exposure that we're used to thinking about with PM 2.5, where levels are relatively similar over time and an annual average probably captures true exposure. An annual average here is missing, I think, big pieces of the story. So we wanted to think about some new ways to try to measure long-term exposure wildfire PM. And so we went back to kind of like the original framework of how we measure exposure, and we're trying to think about three facets of exposure: frequency, how often are people exposed; duration, how long are they exposed; or intensity, what does that exposure look like? And so we came up with basically 5 different measures of a long-term exposure to wildfire PM that fall into, we had a lot of arguments actually about this Venn diagram, so I don't know where exactly they fall into, but they're capturing different facets of this Venn diagram. And those range from things like the number of weeks during a year where wildfire PM exceeds a certain level. So for us, we're thinking about the number of weeks that exceed a level of 5 micrograms per meter cubed. Also, how about the number of days where there's any measurable wildfire PM? So PM over 0. What about just capturing that peak week of exposure? Like, is it the peak exposure that really matters, that kind of tips us over in some biological process? And so we also wanted to calculate the average level of exposure during the worst week of exposure every year. We also calculated smoke waves because some prior epidemiologic studies have used this measure, but we're defining that as consecutive days that have wildfire PM over a certain threshold. And then, of course, our friend that is more analogous to what you would see in most of the air pollution literature, which is just average annual wildfire PM. And so we want to think about that. And then, of course, there are, always more complexities. So thinking about lags, what's the induction time that matters? Are there sensitive periods during the life course? Or if we're thinking about, for example, pregnancy, that might really matter. So I'm going to go forward and tell you a little bit about we did this in California from 2006 to 2020, tell you a bit about what it looks like, and then go into that environmental justice study. I'm not going to walk through in detail the metric that we used and how it was created. This is published in Environment International. Rosanna Aguilera at UCSD was the student that led this, and Tarek Ben-Marnia at UCSD led the development of these measures. But basically, it's using a combination of satellite imagery to identify locations that are smoke exposed every day, using ground monitoring to figure out what levels of total PM are, and then using multiple imputation techniques to basically figure out what would have the background PM levels been in a location had there not been a wildfire. Then subtracting it off from the total measured level of PM so that we have measures of both wildfire PM and non-wildfire PM in places over time. So using that methodology, we kind of end up here with a summary of our wildfire metrics. And I apologize that it's so blurry. But you can see, I guess we can get the bigger picture take homes here, which are, they're somewhat similar in areas that pop out as being the worst, but there are differences in the spatial distribution of exposure across these. This is summarized over the whole study period. So if I showed you these maps year by year, things can additionally look quite a bit more different. So the first one are the weeks with wildfire PM over 5. Then any wildfire PM, the peak week of exposure, smoke waves, and then finally annual mean over the study period. So different places in the state pop out. And this is a histogram showing you each exposure by year. So you can see some years are much worse than others, and the measures tend to track together. So 2020 was worst year for every single one of these measures across the state of California. Horrible wildfire year there, as I'm sure we all remember. But there are differences in how these stack up over time. We also kind of see some seasonality that's of interest. So these metrics can have differences. This is smoke waves that appear to peak in September across the state of California over this time period. And this is monthly average wildfire PM, which peaks in August. So there's some differences in kind of which facets of these we are capturing over time. And this is one metric. This is the annual average wildfire PM at the census tract level across the state of California. And so obviously some years are worse and some parts of the state are worse off in certain years. So you can get a sense kind of the large scale temporal variation here as well. Okay, so we identified this and we wanted to think about whether there are disproportionate exposures among specific communities in California over time. And I've been putting this definition up because I think in the last year, I have seen the term environmental justice community in like the New York Times and the Washington Post. And I think I didn't know what people meant by that actually when I first started reading it as someone who does environmental justice work. So it was helpful to go back and see what we actually are talking about when we say environmental justice community. And this is what the White House Environmental Justice Council thinks an EJ community is. So pretty reputable group, I think. But basically, these are geographic locations with significant representation of persons of color, low-income persons, indigenous persons, and members of tribal nations, where such persons experience or are at risk of experiencing higher or more adverse health or environmental outcomes. So it's a pretty broad, inclusive definition. And to me, this links back to kind of this double jeopardy, right, that some communities face where they have both socioeconomic disadvantage as well as disproportionate environmental exposure. So we see this for all types of environmental exposures, from traffic-related air pollution to lead in water to poor quality housing. We see this across most environmental exposures. But does this extend to wildfires was our question, right? So we've seen a lot in the news, headlines like whiter, wealthier areas are more likely to get help after fires. Wealthy homeowners experience the highest wildfire hazard risk. Our colleague Marshall Burke from Stanford, who's done quite a bit of wildfire research, saying that minority and low-income populations are, if anything, less exposed on average. So I think this was to me kind of the narrative in the literature, in the scientific community around wildfires and environmental justice. But I wasn't sure, so I wanted to kind of use these data and take another look, especially when thinking about exposure slightly differently. And so specifically asking, were disadvantaged communities or communities of color disproportionately exposed to wildfire PM in California over this time period? So to look at this, we used a couple data sets, California CalEnviroScreen. Perhaps folks are familiar with that, but California Office of Environmental Health Hazard Assessment created this tool. It's a measure of the cumulative impact of environmental exposures and social vulnerability, and is used actually in California to allocate policy dollars at the census tract level. So an important measure for the state of California because it's really tied to funds for these populations. CalEnviroScreen does not include race and ethnicity as one of the measures, so we wanted to look at that separately. So just to give you a sense of California's CalEnviroScreen scores, here higher scores represent more vulnerable communities, and usually in California, this is broken down comparing the fourth quartile, the highest quartile of scores, to the lower three. And that fourth quartile are usually being defined as disadvantaged and those that should receive additional policy dollars, for example, from the cap and trade bill in California. And so you can see we had to use for our study two different versions of CalEnviroScreen, one spanning 2006 to 2012 and the other 2013 to 2020. You can see the distributions look relatively similar. If you zoom in to places like the Bay Area and LA, you will see some differences. Some people really don't like this measure. And I'm very happy to talk about that in the Q&A. It doesn't do everything perfectly, and especially at the local level, maybe missing places that are absolutely disadvantaged because there are these 20 variables that go into making up the score and how they're weighted. So happy to chat about that if people are interested. But we did use it in this study, and we're looking at the highest quartile and defining that as disadvantaged census tracts. So this is a plot looking at 1 year, 2020, so the year I told you had the highest levels of average wildfire PM. And it's this bivariate map. So if you look on the x-axis, we're looking at higher annual average wildfire PM concentrations. So bright orange are the highest quartile of wildfire PM exposure. And then if we're looking at the CalEnviroScreen score in purple, dark purple represents higher, so the fourth quartile or disadvantaged communities. So when you find this, I don't know what color this is, the purple orange in the top corner, those are the communities that have this dual burden of the highest levels of wildfire PM and also measured as disadvantaged based on CalEnviroScreen. So these might be the places that we'd be most worried about in 2020. And so you can see a lot of that is falling in the Central Valley, but there are other places as well. And we did this similarly in all the other years, and we start to see differences. So often Northern California has a lot of wildfire PM, but is less disadvantaged. And then so when things hit Southern California, that's when it tends to get worse in terms of disadvantaged communities being disproportionately exposed. So I put equations on here, which I'm now sort of regretting, but we then decided to we wanted to look in a regression modeling framework, look at the relationship between CalEnviroScreen and wildfire PM. We did this for all 5 of those metrics that we created. I'm not going to show them all to you because it's too much. It's really even too much for one paper, but we did it. But I'll tell you about this a bit. But basically we do this overall first, just looking at the relationship between CalEnviroScreen, and we're going to look at annual average wildfire PM, controlling for population density and year, and also this spline term on latitude, longitude to try to control for some spatial confounding. And then we also include in the next iteration this interaction term between year and CalEnviroScreen score to see, does this differ by year, essentially? Because this is the model that basically everyone has ever looked at before in the literature, kind of smoothing across time to answer this question. We wanted to know, wildfires are very different each year, so do the results change yearly? The answer is yes, the results change. So y-axis is the mean difference in wildfire PM comparing disadvantaged to not disadvantaged California census tracts. So anything below 0 would mean less disadvantaged tracts are more exposed. If it's above 0, that means disadvantaged tracts are more exposed. So on average, from 2006 to 2020, we see that we don't appear to have this environmental justice problem, right? Disadvantaged tracts are actually slightly less exposed. Not, a huge magnitude, but that would be the conclusion we would come to. Yeah. The orange then just is like pulling across what our average is across the study period. But we have a number of years actually where disadvantaged tracts are disproportionately exposed in the state of California. And so it just varies very, very much year to year. So looking across some longer period may not make sense for this question. So then we wanted to turn to race ethnicity. We did some things similarly. Oh, this is just to show you, where people live of different race and ethnicities in California. So the first map is Hispanic populations in California, which are pretty broadly dispersed. Asian, non-Hispanic Asian, non-Hispanic American Indian, and Alaskan Native populations. So this is using 2010 census data. Non-Hispanic Black populations and non-Hispanic white populations. So just to give you a sense, because where people live is obviously very tied to which wildfires they're exposed to. So we wanted to look at this kind of descriptively first. And so this is a figure that's just showing you the overall composition of racial ethnic groups in California. So the y-axis sums to 100% to cover all the people in California. And then it's broken down by race and ethnic group. So the periwinkle is non-Hispanic white, the dark purple is Hispanic, followed by non-Hispanic Asian and non-Hispanic Black. And I'll point out the non-Hispanic American Indian is this orange color. Okay, so that's the overall composition. And this is then the average exposure on the x-axis and the composition of people exposed at that level. So the most exposed populations are here on the far side of the x-axis from 2006 to 2020. And so we do see this gradient where at higher levels, the percent of non-Hispanic white individuals is higher. But then if we look at this year by year, we get a very, very different story. So we have 2018 where we actually see this really large, definitely relatively very large uptick of exposure among non-Hispanic American Indian populations. 2019, we have a disproportionate exposure among Hispanic people in California. And then 2020 went back to kind of more similar to this overall average where the most exposed population does appear to be non-Hispanic white individuals. So again, pointing to what's masked when we smooth across this long time period. We also constructed this measure of relative exposure. So we wanted to know, relative to the distribution of people of a certain racial ethnic group across the state of California, how exposed is this population to wildfire PM? So I'll let you look at the preprint if you really want to look at the equation, but this is just to say, if the relative risk is greater than 1, the racial ethnic group is overrepresented among the exposed population. If it's less than 1, they're underrepresented. And so we did this 2 ways. One, for kind of a continuous measure of wildfire PM. And so here we see pretty consistently the non-Hispanic white population is overrepresented among the exposed population with relative risks of around 1.2 to 1.5. But when we look at the non-Hispanic American Indian, Alaska Native population in California, these relative risks are much larger and range from about 2 to nearly 4, depending on the year. And then we see some differences where also every year, non-Hispanic, Asian, and Black populations are less exposed than we would expect based on their statewide representation. And then when we look at this for the risk of having an annual average exposure over 25 micrograms per meter cubed of wildfire PM, which is a higher level that certainly would have health implications. These are really strengthened even more for the non-Hispanic American Indian population. And we have, for example, 2014, a relative risk of 37, and 10 in 2018. And so kind of digging into it this way was very interesting to us and something that I haven't heard talked about really in California. So I guess the kind of take home here is that wildfire PM does appear to disproportionately affect persistently marginalized populations in California in some years. But indigenous populations appear to be disproportionately exposed every year. Okay, so now what's going on? It looks like in the western coast of the U.S. and in certain other parts of the world, wildfires are becoming omnipresent during wildfire season. We need to figure out how to measure this exposure in a long-term sense, and in order to understand what this means for health. And we need to think about how we're calculating exposure because that has implications for environmental justice considerations and how we might allocate policy dollars for mitigation, adaptation, rebuilding. And so I think for me, as an environmental epidemiologist, next steps are kind of studies of health after this long-term exposure and health. Okay, so what are we thinking about next? My plan is to keep working on long-term exposure to wildfire PM, absolutely. And we're actually running analyses at Kaiser in Southern California right now, trying to look at long-term wildfire and incident dementia there. But the computer's breaking, so once we fix the code, then we will keep running those analyses. So I'm excited to keep thinking about that. But I'm also really interested in considering wildfire disaster as a unique exposure and residential proximity to places that actually burned, or living in an evacuation zone as a unique and different exposure, especially among some of the populations I'm most interested in, like people living with dementia, where changes in routine or needing to evacuate could be extremely difficult, or people who are pregnant, who what that means for receiving care or the levels of stress could profoundly influence health much above and beyond exposure to wildfire PM. And so also have ongoing work characterizing wildfire disasters, which has been, I kind of wish I'd visited OSU a year ago when I started doing this, because it sounds like a lot of people here are thinking about this really carefully, and mapping this for the entire country. So this is just a little snapshot of kind of some of the work I'm doing with Kaiser in Southern California. And so we've identified specific fires as wildfire disasters, and we're calling those fires that burn structures or had a FEMA declaration and overlapped with a community of a specific population density, or a wildfire that killed a civilian. And so these are the fires in the Kaiser region that met that criteria. And then you can kind of see the number of Kaiser patients living in zip codes that are over the age of 65. And so we're trying to figure out analytically, like, which of these fires we can study well and what we can learn about living close to them in the short term, what it means for health, and then also living close to them multiple times in a row, what that means for health, and what that might mean for health over a longer time period. And so excited to kind of keep going down that path, and would love to hear thoughts from people here, because I know we have some people thinking about kind of evacuation type exposures, population mobility after disasters, and how to conceptualize this and think about it most clearly. So those are, that's kind of the conclusion of the research portion. I just wanted to flag two things. One is this environmental justice boot camp that I teach with Tamara James Todd at Harvard. This is through Columbia University. We're doing our first in-person training this summer in Columbia. So if you have interest in learning more kind of about theory and methods around EJ research in the public health space, this is a potential option to do that. And then I'm sure this has already been promoted to you, but the first ever ISEE North American chapter meeting is happening here. So if you're around this summer, it would be really wonderful for students to attend. I think it's going to be a really cool opportunity. At least 300 people from across the US that do environmental epi should be coming to Oregon State. And Perry and Molly have been integral, as well as Matt, in helping organize this. So anyway, it's approaching soon. I'm very excited about this. And the theme of this conference is environmental justice and climate connections. So super relevant to a lot of the things most near and dear to my heart. So I'm going to stop there so we have plenty of time to chat. These are a lot of the people working on this project with me, but probably not all of them. And then this is the link to the preprint of the paper that I was talking about today, if you want to take a look or find errors and let me know if they are. Okay, cool. I'll stop there. Thank you.
Hey, questions? And talk loud and make the mic.
Sorry, I'll talk. Am I projecting loud enough? Then I'll start. Sorry. Gee, that was fantastic. That was really interesting. I thought interesting to see the indigenous recommended population there. Did you overlay that with tribal ancestral land? That was knowing the year, the Corn Cow and the Maidu ancestral land were very close to the paradise. So I was just curious of those.
Yeah, that's a good idea. We didn't do that yet. We've looked at kind of, oh, I'm sorry. Should I repeat? Yes, let me try again. To our colleagues on Zoom, thank you for being here. The question was whether we overlaid the fires with actual reservations or tribal lands in California. because of this kind of newer relationship that we saw that American Indian populations in California seem to be disproportionately exposed. And my answer was, we have not done that yet, but we probably should. The vast, yeah. So my guess is that we will see mostly that's what's going on here, because those will be the more rural places that are highly exposed in certain years. But I think thinking about, we've been talking a lot about interventions today, and thinking about kind of like what the mechanisms would be for dealing with some of these exposures. I think understanding if these are federal lands, if these are tribal lands, will be key to kind of what the next step would be. Please, you have a follow-up.
Yeah, just to follow up on that. So I know the CONCAT and then we were both that could negotiate with PG&E to try and have more rights over the electrical lines that go to the ancestral lands to try to abate the fire risk there. So it was a really interesting kind of intersectional.
Very interesting. And you've hit on my other favorite research topic of power outages in our electric grid. So I think super important and interrelated with a lot of these climate exposures, and also kind of like the very human side and the side we have some immediate option to do something about. So yeah, really important. Yeah.
When you measure harmful particulate matter in a certain area, you're not really measuring exposure, you're measuring potential exposure. Because especially in summer 2020, a lot of people never left their air-conditioned homes. Is there any way to account for this?
Yeah, it's a great point. The point was that when I'm saying exposure at the census tract level, it's not really what I mean. I mean concentration, because it's ambient, what's outdoors. And a lot of people, especially more privileged, wealthy people, didn't leave their homes and probably weren't exposed, or did leave their homes and left California. And so what can we do about that? Yeah, it's a hard question. So one thing I think about a lot here is like these are likely kind of like baseline inequities that we are measuring, because people with more privilege and generally live in more advantaged communities are going to have lower exposure than the disparities are going to be larger than what we're measuring here. What people have done, so there's some work, again, our colleague Marshall Burke at Stanford has been using purple air monitors in California. Others have been doing this too. So when these purple air monitors are sited, they can be both indoor and outdoor, and you can see kind of what are people exposed to in their homes versus outside. The indoor exposures are still pretty high in a lot of these places. I mean, not 300 micrograms per meter cubed of PM, but it's 50 micrograms per meter cubed PM indoors that people are experiencing, even when, these purple airs are mostly wealthier people have placed them on their homes. And so even in more advantaged communities, there's still infiltration. So we can't, with what we're doing here, we can't get to the truth of kind of what's entering people's lungs. We're kind of providing a bigger snapshot, but I think it's an important next area. Yeah, please.
The Bureau of Labor Statistics has really detailed information on livelihoods, occupations, places. So what you might be interested in finding out is for census tracts, what sorts of occupations are outdoor occupations. Yeah, farming it might really kind of ship the results.
Yeah.
So, Hispanic population.
Yeah, I think that's right. So David's point was we have information on what occupations people hold in different census tracts. And so if we are able to kind of subset to primarily outdoor type occupations, that would help us get closer to the truth and would probably also uncover some additional disparities, particularly among Hispanic individuals in California. And I agree with that. And I also think it would turn it more towards rural areas where more outdoor work is taking place and levels of exposure tend to be higher. So yeah, I think that would be, it's a good idea. I don't know. That's for happy hour. Okay.
Comments about how little we know about that some people remind me of something that we found from a study, an evaluation study I was involved in. There's an extension-led study of the health effects of the wildfire in June, which is used to stay on year 1 year after fire. You mentioned how bad 2020 California, probably the worst year. And so we, our team went in there and we did focus groups of people on those kind of fires. And we also did a survey which provided everybody with the picks of the other representative sample just the patient. And one of the things that came out, mental health was the biggest and it was affected. But in addition, after that was probably the number one of the things that really struck us was that people reported breathing problems for their animals and stuff as well as themselves. A lot of these people were not seeking medical assistance. It was really flying on the radar. So people were saying, yeah, I just have these breathing problems. Later, we said, what are you reporting? They don't know. Just do a little bit. So that really struck us. So it's just something that developed.
Yeah. So the point was a study here in Oregon that looked at health problems among people a year or so after, a year later after 2020 fires, and found people reporting absolutely mental health challenges and then additionally breathing problems. But these people are also saying they're not seeking any health care for the breathing problems. And so, it speaks to this point, like the limitations of kind of the big data type approaches and needing to understand what we're missing. Is this, for some conditions, tip of the iceberg? For others, we're doing pretty well. But I think certainly for things like that, we're not doing great. And especially with mental health, we're also probably, if we're seeing a signal of mental health in, for example, electronic health records, like, wow, what's really going on in the population? So,
TJ, do you have any?
Given that both were injury to mass disposers, were you able to determine any differences in exposure to that type of individual?
Cool. The question is, did COVID masking change exposure? The answer is probably yes. We definitely did not look at that. I would also anticipate just the staying at home during COVID. More people were able to stay at home. Also probably kept exposure lower than it would have been otherwise. So I also think there's trends over time in kind of messaging and adaptation. Now, COVID also sort of normalized wearing masks. So maybe now during wildfire season, it's more common. I can say my experience on the East Coast, there was a time in 2020, I guess, when actually wildfire smoke hit New York City from the West Coast. And no one there did anything. Like, all the kids were just out playing. People were just living their lives, going on runs. And like, from spending more time on the West Coast, being from the West Coast, I was looking around like everyone was, it was nuts to me. But so I think that was kind of like where maybe we were on the West Coast a decade ago or something, where it was just kind of like, oh, it's really hazy and it smells like smoke. I'm just going to keep going about my life. And I do think there has been a change, and particularly people with underlying conditions. There's messaging to some extent. And so actually, we've been seeing kind of nonlinear relationships with wildfire PM in California, where at the highest levels, the effects seem to drop off. And it seems to be like at some point, a lot of people are changing their behavior is what we're guessing is happening. Could be some other explanation. But my guess is that at very high levels, people are staying indoors more, or using filtration or turning on the AC. So, super long answer to the fact that no, we didn't do anything with COVID masking, but I think there's like a lot of these behavioral complexities that we're going to have to contend with.
When you're dealing with fires,
No, good. No,
when you're dealing with fires, there's a lot of stressors besides just the PM.
Mm-hmm.
How do you involve all these things?
Yeah, you're down the research line. I have not yet. So that's something I'm really interested in. So some of the things I'm thinking about, this difference between the stress pathways and proximity to fires or having to evacuate versus PM. But there's also, other types of environmental exposures. So we also know ozone levels go up a lot when there's wildfires. Depending on what burns, there can be different components of the air pollution. So no, I think we're just like, yes, all important questions, but not ones that have really been contended with yet. Yeah, it's pretty early on.
Oh, great presentation. Thank you. I'm interested in the mental health side of things, so brain health. And if there's a particular science fraction that may be most linked and from an inhalation exposure and kind of how that's getting to the brain and then kind of what's happening there from a, you mentioned mental health and dementia. And I'm wondering, are they repeated? How just speak of some of those?
Sure. Oh, I forgot to repeat the last question, but I will repeat this one. This question is about mental health and whether there's a size fraction of the particulate matter that might matter more and kind of this interplay of mental health and dementia. So my hypothesis is that ultrafine PM matters more for brain health because it can enter directly through the nose, get up into the brain. But we also have, of course, a huge amount of literature on PM 2.5 and health endpoints through other pathways like inflammation that might really matter. So I think I'd like to learn more about ultrafine from wildfires in addition to PM 2.5 from wildfires for this. And then, I think the interplay of mental health and dementia is really interesting. And I don't know. So talking to a couple, Holly Elseron here is a neurologist. And it kind of seems like this is a bidirectional relationship. So having depression seems to be a risk factor for dementia. It's not yet clear whether it's like an early manifestation of dementia or it's actually a separate entity that is a causal factor that could lead to dementia. And we certainly know that people have dementia have a whole host of mental health problems because having dementia is extremely stressful. And so that those two go hand in hand. And so I think some of, wildfires, but also other unexpected massive climate exposures may have I think there's similar questions to be asked about them related to these endpoints. Yeah.
TJ, do we have any questions?
Not right now.
We do have some time after this, so if we don't get your question, score going. Boy.
That was great. And my question is kind of Lindsay pain that stress. And I'm just curious. Is it we need to use that be able to drill down and look at the intersection between the PM2.5 and then also the by wildfire. It's like so for those people that either had to evacuate or lost, they couldn't do it. Are they able to drill down to that? Well,
that is the plan. Yes. We have about 100,000 people at Kaiser with a dementia diagnosis and about 200,000 people with a cognitive impairment diagnosis that some portion of them progress in the health record to dementia. So hopefully this is going to be enough. And unfortunately or fortunately for us, from a scientific point of view, there have been these fires that are like in LA in the last several years, right? The Getty fire was right in LA. A lot of people were pretty exposed. So we do kind of have that cross product of super high levels of PM, not proximate or evacuation, high levels of PM and evacuation, and then kind of, so we have the 2x2 table. So we're hoping to be able to look at that. In a recent study, we looked at them separately. We didn't stratify by PM. We just looked at both separately with all-cause hospitalization and saw, both appeared to be predictive, but we haven't, that's the next phase. But yes, I'm very interested in that as well.
We can last question.
Okay, so I'm not super familiar with that. I was wondering if we're thinking about long-term exposure in populations. If research look at what that looks like within the responders along with firefighters, and if there's been research that looks at the same long-term effects that we might see in these populations we talked about within the
Yeah. So that was no, it's a really good question, because when I started asking this question to myself, that was the first place I went to look. And the answer is there's not great information, unfortunately. The studies have done things like looked at time on the job as kind of a proxy for exposure. There has not been kind of like a large scale longitudinal study that measures like what people are actually exposed to over the course of their career. And then we have had this problem with all these occupational studies around healthy worker bias, right? And so the people that have been exposed the longest, you know, maybe they would never get sick because they're immune to whatever is happening to other people. So it can be really, I think, can be hard to drill down into. There have been some lung function tests that are, I think that work has been pretty high quality. That's like measuring pollution levels and then right away measuring lung function and doing that repeatedly over a season, and definitely seen like detriments, but that seem to improve again. But again, these are generally like healthy, strong, relatively young people. But I think it's definitely an open question. And we know that wildland fires and firefighters have elevated risk of things like cancer, many types of cancer. So, engaging further in that, and people that work on occupational, it'll be really helpful complement, definitely.
Okay, so I think we're going to end on the last question for the Zoom.
Are there studies that show the connection between public agency funds and PM?
Not that I know of. Public agency funds for do we know what they're for? Okay. No, I guess maybe the question is, does having funding to try to mitigate exposures help? And I haven't seen any kind of like evaluation studies of, community clean air centers or things like that we might want to provide people access to. So I guess the short answer is no, I haven't seen that yet.
Okay, so we are going to be hanging out here. If you guys have time to stick around for discussion, but please join me in thanking Joan.